Welcome to the Increda-dental podcast. I'm your host, Alicia Flynn. Our goal is to make a positive impact in the dental field. I have been a dental assistant, a biller, an office manager, a scheduler, a hygienist, and a dental coach, which makes me your biggest fan. My husband was in the military and we traveled all over the United States. I had opportunities to work in many different practices, and I saw incredible practices and practices that had a lot of potential within them. Thank you for joining us. Let's dive into the podcast. Welcome to the Increda-dental podcast. I'm your host, Alicia Flynn. Today, we're going to speak about how to elevate your dental assistant's value, as well as increase the patient care, which means better patient health, and also the health of the practice. So I want to let you know that I worked as a dental assistant for over 25 years. Now, I had the opportunity to work in many states because my husband was in the military. So I worked in Colorado, in Indiana, and several other states. Now, in Colorado and in Indiana, the dental assistant can place restorations. They can also adjust crowns and cement the permanent crown. So when we moved to other states, I had to redefine what I did as a dental assistant, and I had to create value with what I could do within the state. And sometimes that was a struggle, but these are some of the things that I learned, some tips to help increase the value of your dental assistant if there are other laws that prevent your assistant from placing restorations and doing other things that states like Indiana and Colorado do. So number one, make sure that your dental assistant is educated. Now, the best way to do this is actually with the patient. So if you're treating a patient and you're placing a composite restoration, to ask your dental assistant, why are we etching the surface of the tooth? And then let her answer. And if she says, I don't know, or if she doesn't know, educate her. Because what's interesting is what happens is it shows that you know what you're talking about. It increases the value and respect from the patient to the dentist, to the provider. And it also educates your dental assistant. It helps her understand better about procedures and techniques. So take that opportunity to educate your dental assistant, to understand her knowledge or his knowledge, and to make it more involved, more in depth, helping them to be educated. Because the next thing that I want them to be is aligned with you. So that's number two. I have been in offices where the dentist walked in, told the patient after looking at the x-ray and doing the exam, they need a crown. The dentist leaves and the patient turns to the dental assistant and asks, do I really need this? And I have seen where the dental assistant goes, I don't really think so. And it's what that's done is it's shown that they don't value or respect what the dentist is diagnosing, but also that they don't understand. And so they're not educated. So that's why we have to start with education and then go with alignment, because there are many questions that the patient will ask the assistant or the hygienist, but they won't ask the dentist. So we need to make sure that we're aligned and we understand that we can explain to the patient why they need this treatment. Why do I need a crown? And also, what are the risks if I do not do the crown? And it just helps align your practice to be stronger. So it's a huge part of your practice that sometimes we don't realize we're not tapped into or aligned well enough. Number three, have your dental assistant present treatment plans. I've seen dental assistants do this for sedation dentistry, for full mouth rehab, orthodontics, aligners, whatever it is that you offer that might be more of a specialty in your practice, or if it's a regular treatment plan, have your dental assistant present the treatment plan. Get them comfortable. You can start with them as the dentist or the provider to begin with of the treatment plan, and then gently excuse yourself by saying, Susie, my assistant here, is very knowledgeable and she answers the questions better than I do. I'm going to turn you over to her and she will take care of you. And then as the provider, you can leave the room and then let your assistant take care of it. It shows trust. It shows that you understand what you're talking about and that your assistant understands what they're talking about and that you're aligned. And it also opens the door for patients to ask questions that they normally would not ask the dentist. So that's a huge part of having a dental assistant with expanded functions, if you will. Additionally, make sure your dental assistant is crossover trained. They know how to answer phones, they can schedule, they can enter insurance information. But I also encourage your front office to be crossover trained too. Have them know how to help with a couple procedures, main procedures that you do within your practice. You want to have people crossover trained in your practice for several reasons. Number one, people move, people get sick, and unfortunately, sometimes people die. And with that, it leaves a void in the practice. So if you have people that are crossover trained, you don't have to have your office come almost to a screeching halt. You can have everyone where they complement each other and they're crossover trained to know how to help each other within the practice. Another thing that a dental assistant can do is make sure every patient's scheduled when they leave. Patients are more likely to stay within your practice when they're scheduled for their next appointment. Doesn't matter if it's restorative or hygiene. Every patient needs to be scheduled for their next appointment. So making sure that happens will decrease attrition in your practice and increase patients returning. Kind of the same thing. Anyway, second to the last thing, look for opportunities for hygiene and treatment within the same day. So the dental assistant needs to look at the patients, see who's due for hygiene, see if there's patients in hygiene that are due for restorative, and see if they can fit them in that day for that treatment. Because it's much easier to see the patient who's already within your practice that day than it is to bring them back for the second visit. So look for opportunities, both in hygiene and in restorative, to have the patient stay to complete treatment. And then the last thing is that if you find yourself referring a lot, maybe for oral surgery or implants or periodontal treatment or for endodontic treatment, whatever it is, keep track. Because this is what happened at one office that I worked at. We had a dentist who was referring out around 5 to 7 implants a month. And I asked him, do you know how many implants you're referring out each month? He's like, I don't, but I know it's quite a few. I told him, well, it's basically 5 to 7 a month. That's a lot of money walking out of the practice. And he stopped and really thought about that. And then he said, I have been interested in placing implants. I've been a little shy to attend the class. So within 4 months, he attended the class. He started placing implants. And the number from 5 to 7 implants a month of people being referred, actually, we were placing around 14 to 20 implants a month when we first started, because patients want to stay within your practice. They've already built up a relationship with you. They know you, they trust you, and they don't want to have to go to other offices for treatment. So if there's a treatment that you are referring out consistently within your practice, and it's something you would have an interest in adding to your practice, chase after it. Go get it. Or if it's something you don't want to do, maybe bring someone into your practice 1 day a month or 2 days a month to meet the patient's needs, because it is a compliment to keep your patients within your practice, and it helps them feel that they are being served. So these are great ideas to help elevate your dental assistant. Thank you for joining me. I'm Alicia Flynn.